Hello and welcome to the Medical Sales Podcast, and I am your host, Samuel. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire country. And it doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing to diagnostic lab, you name it. You will learn how to either break into the industry, be a top 5% performer within your role in sales, or climb the corporate ladder. Welcome to the Medical Sales Podcast. Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel, and today we have with us another special guest, and she goes by the name of Crystal Sobande. This episode is truly special because Crystal came to our program, I want to say 3 or 4 years ago, so our early days. And we showed up 110% and she got a position. And now, not only has she had a fantastic career at Medtronic, she is in a position to help our current clients get positions. And she actually did with Eric Johnson. Really is a treat when I get to see something like that full circle, right? To see someone that went through our program in the early days, started a career, in the middle of their career, and then come back and now find candidates within our program to take into the company again. I mean, it's a beautiful thing. And I love being able to share this episode with you. So I'm not going to say anymore because I don't want to spoil it. I don't want to give anything away. This is a treat. Honestly, I know that I believe every episode is a treat, and I really do. But an episode like this is a rare treat. So as always, thank you for listening to the Medical Sales Podcast. We always do our best to bring innovative guests to you so you can hear what they're doing in the medtech space. And this guest definitely fits that bill. So without further ado, I really do hope you enjoy this interview. Hey, Crystal, how are we doing today?
I'm doing well, Samuel. How are you?
I am fantastic. Today is a special day because, everyone, Crystal, she graduated from our program how many years ago?
3 years ago now?
3 years ago.
3+ years ago?
3+ years ago. And, that was the beginner stages of our program. Our program is so advanced now. We've had hundreds of people go through it. But what I love about Crystal being here is she's living her best life in the medical sales space. And she's doing things and she's making moves and she's going to tell us all about it. But it's just so cool to have a guest that came from the program. So with that being said, Crystal, why don't you tell everybody who you are and what you do?
Oh, absolutely. Well, I'm excited to be here first and foremost. I currently am a clinical specialist for one of, I would say, the top medical device companies out there. I work in the cardiac rhythm space, specifically selling pacemakers and defibrillators. I have actually recently, as I just disclosed to Samuel, am going to start a new position as an account manager in the cardiology space. So super excited about that. With a different company.
And we'll touch on that, but what I think it's important to understand with what you just shared is, a lot of times you start off with a big name company to get the training, to get the just the backing that you're someone that in this space you've been trained well and you know what you're doing. And then as soon as you put in a year or two, maybe the opportunities out there, they really grow. And if there's something that just makes a lot of sense that you have to move to, then that's what you got to do. And in your case, that's what happened. But we will get there. Let's get back into your field. I want you to explain what your field is, and we're going to just get into it because I want the audience to be crystal clear on your space, the cardiac rhythm space. So go ahead.
Absolutely. So with cardiac rhythm, I always tell people it is not for the faint at heart at all. As I was described, it's almost like getting a master's or a doctorate in electrophysiology, right? So you have to know just as much as the EPs, the cardiologists, technically as well as clinically. My days, they sometimes start at 6 a.m. I'm outside, I'm in the cath lab, I'm in implants all day long, and then you're bouncing between an implant to a clinic, and then you might not be done until 7:30, 8 p.m. at night. right?
let's walk through. We got to see like a visual experience that we
A
can
visual.
picture in our minds. Take us to it. You wake up at what time and
All
walk us
right.
all the way to the nighttime.
So I wake up, I go to sleep, or let's start with here. I go to sleep thinking my first case is at 10 a.m.
Okay.
And I get a call 6 a.m. and it's like, you have a case in 30 minutes, patient's gonna be on the table. Right? So you rush. You're like getting dressed in the
Yeah,
car,
yeah.
pretty much finishing up, getting dressed in the car. You're on the way to the hospital, speeding there the whole time. Everything's just in chaos. And then you're rushing, you do this implant for about a good 45 minutes to an hour, and then you might wait for a little bit, right? You might not have your next implant for an hour, 2 hours.
Right.
It's definitely a hurry up and wait lifestyle, or you could just have back-to-back implants, right? Between that, you're getting paged, hey, go check a patient on this floor, go to this hospital and have this patient checked, right? People's hearts never stop. So you're
Thankfully.
constantly gonna have to be on top of that. So you're constantly bouncing around, getting called, getting pulled from every which way all throughout the day. You have clinics, typically we work on as a team. But you work as a team, but your job is very autonomous at the same time. You work by yourself, so you have your own schedule, but as a team, you work within a territory to be able to cover all of the different hospitals and all of the different clinics. And we're talking about, there could be up to 5 or 6 different hospitals, 7 clinics going on all at the same time, and maybe 4 people on your team. So it's very much a divide and conquer type of thing.
And so let's dig into that a little bit. So you're saying 4 people on the team, you're all covering the same, I guess, region.
Yes.
And so basically if Bob can't make it and Jessica's available, Bob will call Jessica to come help. And then if Sally can't make it and you're available, Sally will come you to come help. Like that's how it works.
Correct.
So then when you have a scheduled procedure and someone else has an issue, what normally happens?
So if there's a scheduled procedure and say, for instance, it's supposed to be something simple like a pacemaker change out, and one of the leads go bad, you don't have that specific lead. Now you're scurrying, you're texting everyone in your Rolodex that's nearby, and you're like, I need this lead ASAP. And so it's kind of one of
So
those
hold on,
fire
hold on.
drills.
You got to define lead,
Lead.
Crystal. There's
Okay.
so many
So
people like, what is she talking about? So go ahead.
gotcha. So the lead to the pacemaker. So typically pacemakers will have 1, 2, or 3 different leads. Each one will sit in a ventricle of the heart. And that's what they use to actually pace the tissue of the heart. And so sometimes during a change out, typically we never want to say it's just a change out, right? Because right when you think things are going to be
It's just a change
simple,
out. It becomes something
right?
else. Right,
That's when things go bad. You never want to say it's an easy day, because that's
sure,
when it goes crazy.
sure.
But every once in a while, you can get in there, you think everything's good, and then it's like, everything is not good, right? So this lead, maybe the insulation has fractured. So now we need to go, since the pocket that patient is already open, the best thing to do is just go ahead and put in a new one. I thankfully have never had this situation, but there are times where I've seen it where other companies, if they are not prepared or someone can't get there soon enough, you've just given it to your competitor, right?
So
The
what
doctor.
does that look like? Because that's talked about a lot, but I
Yes.
want you to walk us through the experience of that happening. Like, what does that look like?
Well, I specifically have not gone through that, thank God.
Amen. Yeah.
However, what that would look like is, okay, well, the physician says, all right, well, we need this. The person says, I do not have that on hand, but I can get it, right? That's their go-to. I can get it. How long is that going to take? And then they may say 20, 30 minutes. The physician says, well, is X company around? They ask their staff. They're no longer talking to
Wow.
the rep
You
anymore.
you
You're
have
not a
been
part of this
dismissed.
anymore.
You have
Yes.
been dismissed. So so let's say that happens and rep so and so from company so and so has it and can make it. Are you sent home or what happens?
Yeah, yeah, I mean, you're not sent home, but you're out of that case. You're
And
out of that case, and you kind of, you have a lot of kissing to do afterwards, right?
yeah, because what I'm curious, how does that impact the reputation that you are trying to establish? Is that something that people just understand happens, or would you say, you did specify that it hasn't happened to you, thank God.
Right.
So what how bad is it when something like that happens with a rep?
I would say if you're trying to establish rapport with a physician that you don't have great relationships with already, that's very bad, right? It can happen, right? It can happen. There are times where things are on back order, and every company goes through this, right? Where little things have been on back order for months, so we're scrambling, and all across the country, everyone is short on a specific type of product, but your physician only likes to use that specific type of product. So they for the most part they understand. But these physicians can be, very particular, right? So they want what they want.
Sure.
And some days they can be more particular than others, where they're like, hey, I don't want to deal with this today. I don't want to wait 30 minutes. Other days they might say, hey, I'll wait. That's
Sure.
fine.
Sure.
And a lot of that also kind of boils down to the person that they're working with, the relationship that you already have with that physician.
Right.
If they kind of just don't really care for you to begin with, they're not going to give you a chance
Right.
at all.
Right. Right.
So,
So let's talk about that a little bit. First off, with the way it works with your team, so would you say that the moment you wake up to the moment you end your day, you really don't know what can happen, even though you have a bunch of scheduled procedures? Or would you say that it's relatively controlled?
no, you never know what will happen. You don't know what's going to get added on. You don't know what's going to be canceled. You have an idea of what your day may look like, but you can never think that that's what your day is going to
Sure,
be.
sure.
And if you're that type of person, you do not need to be in CRM.
So for you, it excites you. This is like,
it it does excite me. It does excite me. I mean, it's a thrill, right? Like, it's an adrenaline rush also.
yeah.
At the end of the day, you're like, woo, thank goodness I made it.
So
Right?
yes. So what were you doing before you took our program 3 years ago?
So before I got into CRM, I was actually working for a cosmetic derm office selling cosmetic derm treatments
Sure.
there.
Okay.
Yes.
So how so and so you went from that business into medical sales. And
Yes.
then you got to learn how dynamic each day is. How long did that take from, oh my gosh, what's going on? Nothing is, no day is what I think it's going to be, to, I got this. This is how things work. Let me get cracking today.
So you learn how dynamic it is pretty quickly. As soon as they throw you in the field, you're like, wait, you're like, okay, this is my schedule. I'm gonna be
Sure.
following this person. And then you're like, wait, this isn't happening at 10 o'clock anymore. And they're like, no, hurry up. We gotta be here in 10 minutes. So you learn that fairly quickly.
Right.
If you're adaptable, you'll catch on. It'll be great. It wasn't too hard for me. It's just, it's a mindset that you have to get into, and you have to be okay with it, that, hey, I don't know what can happen. And sometimes things can kind of end up in your favor, where you're like, wow, it should have been a little bit of a more chaotic day, but things kind of dropped off, and it's kind of been more of a chill day today, where I can breathe, I can get more of, you know, I can do modules on the computer, and
Sure.
fill out my expense reports
Sure,
and
sure, sure.
things like that. I can have other things I could focus on today where I'm not running around with like a chicken with its head cut off.
So then, would you say that for everybody thinking about this space, a lot of people are probably thinking, okay, what about the travel? What about the weekends? What about the nights? I try to do my best to make it clear to everyone that the nature of medical sales is travel. And a lot of times it's local travel, just like you guys, you traveling within a region, it's relatively close to where you live. But what about the nights and weekends in the cardiac rhythm space? What does that look like?
So if you love your nights and weekends, be prepared to give some of that up.
Wow. So no, no, you got to give us
All
more.
right.
What does some of that up mean?
I will tell you. So it depends on which team you're on, but you will definitely be on call. That is non-negotiable. You're going to be on call.
Mhm.
So that's at least, and every territory is different how their team operates. But I've now been on two separate teams where once I was on call one time a week during the week, and
Mhm.
then one weekend a month during the month. So automatically, one week out of the week, I needed to be within
Yeah,
the
that would-
territory, couldn't go
that's-
anywhere. And then one weekend out of the month, I needed to stay within the territory and could not go anywhere.
wow.
um, and in this newer territory, it's a little bit bigger. So I'm now one time a week and then once every 9 weeks.
Okay.
So there's a little bit more flexibility there.
Okay.
However, just because you're not on call does not mean that one of your physicians is not going to call you specifically, right? And you don't tell them, hey, well, I'm not on call tonight. I
Why are you
can't.
calling me? I'm
Right,
not on call this week.
exactly. You still have to deal with it, right?
Right,
Like you still
right,
have to answer your phone because
right.
that's why they're using you, is because they're gonna say, hey, I know Crystal's gonna answer her phone at 2 a.m. in the morning. They might be on call, 2 a.m. in the morning, 4 a.m. in the morning, whatever time that is, she's gonna answer her phone. She's gonna get the job done. That's why I can count on her. That's why I'm gonna continue to use the products that she's selling.
Wow.
And so your job never really stops. I will be honest with you, Samuel, before working in this space, I was not great with my phone at all. My friends laugh at me and they're like, you've come a long way with texting and answering your
Not
phone.
that you've come a long way.
Yeah. You have to, you are glued to your phone.
Wow.
I mean, you can't not be. I have at least four Apple chargers around me at all times. You
Wow.
have to be glued to your phone because you just
Okay.
never know what'll pop up,
Sure,
what'll come through.
sure, sure. You know, so talk to me about when you were getting into the position, you knew that you're going to have to really focus on developing customer relationships.
Yes.
But I'm sure even though you had experience doing that in your last role, you don't know what you don't know. So when you got into developing relationships, getting providers attention that are ready, maybe that were even committed to other companies and their products, talk to us a little bit about what that was like, maybe the harder parts of it, the easier parts of it, maybe even share some things that you never thought you would have to consider doing or figure out how to do.
No, absolutely. So I will say that coming into the space, I mean, I did not have a background in cardiac rhythm, EP at all. So I just felt completely lost. And as time went on, it's a slow process to learn, and I'm still learning. There are people who are in the space who have been doing it for 20 years, and they're still learning.
Wow.
It's not anything that you're gonna learn overnight or within a year and say, "Oh, I've got this."
Right,
When I
right.
first started, people that were training me were like, you're not gonna feel good until at least 4 or 5 years in. So just
Wow. 4 or 5
completely,
years in.
yeah, they're like completely just forget about that and just do the best that you can,
Sure.
right? So if you think you're gonna get everything perfect, you're not. You're just not. And so when I was able to kind of get past that, I realized like, okay, I need to learn what I can learn, know what I can know it the best to my capability.
Mhm.
But more so than anything, I feel like what helped me with building rapport was just having a presence. And people take that for granted, how much just being present and
Just
available.
yeah, being available, being there.
Exactly, exactly. These physicians are so busy. They have so many things that they have to do. I mean, we work hard, but they work harder. And just knowing that there's someone that they can call on, that takes you such a long way. I tell everyone who comes into it, I'm like, know your product for sure. Know it, because they're not going to trust you if you don't. But know the product, know what you're doing, because you need to, patient safety is first, but also just be present. You can't hide just because you don't know anything, right? They like to know that the more you're around, the more you're going to learn,
Sure.
right? Just being around them. I've learned so much just kind of hanging around, specific physicians, and they've taken me under their wing and shown me things that I probably wouldn't have learned otherwise. So that's honestly what I would say is stay present, and that's how you'll build your network. And stay present not only with the physicians, but with their staff, with everyone, right? Everyone. When I try to build rapport with everyone in the building, right? Down to the cleaning lady at the hospital. She's going to let me in the door if I don't have my badge, right?
You know,
Right? Like,
I think that's important to mention because people just
exactly.
they don't think about those things. Um, you know, if you could just say in a nutshell, what was so you said be present, just be present. I'm sure you've had accounts where they were not using your products yet, and you were trying to be present. What did that look like for you?
It looked like a lot of rejection at first. Not obvious rejection, but just kind of like, oh, hey, all right. But you have to be consistent. You have to be consistent. So just because you go somewhere the first time and you're not getting the response that you want, you don't say, hey, I'm done with this, I'm not going back. Consistency is key, and consistency is definitely key in this game. You, like I said, be consistent, be present, keep coming back around, figure out what exactly is it, find out why they're not wanting to use your product. Why do they like the other product?
Sure.
What can you point out with your product that, maybe it's just a lack of knowledge that they don't know. Maybe it could possibly be where, I've had a situation where it's not anything wrong with the product. It would happen to be the person before you, right? That they just didn't care for, right? So figure out why, and then their why not. And then you can somehow kind of dig deeper, to figure out how you can carve a way in there. But
Mhm.
there's always a way. You just
Mhm.
have to you just have to figure it out.
Yeah,
Yes.
I love it. I love it. You mentioned something earlier about how you it was a learning curve, all the cardiac uh, education to get caught up and to be able to be a resource to your clients. You know, a lot of people assume that, oh, to get these jobs, I have to study and I have to learn all I can about cardiac before applying. And we literally say, no, that's not what you do. You need to just get the position and then you'll learn. What would you say to that? And to everybody that's thinking, listening to you right now, and they're thinking, I want to be in this, I want to be in her space. What should I do as far as the cardiac education? Or should I do anything? Or should I just focus on the company and getting into it?
No, I completely agree with you. Know the basics. Get into the space. Know what type of space that you're wanting to get into, right? So, for me, I did do some basic, like extremely basic training, right, online, where I just needed to know, well, what exactly does cardiac rhythm deal with?
Right. What do they
To
do?
that extent. Exactly, right? Because you need to know what you're trying to get into.
Right.
But did I know, what ventricular fibrillation was? Absolutely not. Even the first 3 months, I always tell this story. I'm like, wow, after year one, I was like, I've came such a long way. I was reading a rhythm strip, for example, I remember probably like my first 3 months, I was with my technical trainer at the time. And, she's taking me through a bunch of different rhythm strips. And she's like, well, what is this? And I'm answering and I'm like, what is this? And I was like, and if you know anything about cardiac rhythm, I stupidly say ventricular bradycardia, which is not even a rhythm at all. Right?
Oh, that's great.
And I'm like, why would you say that? And because you're learning so much, it's like learning a new language, right? You have all of these new terms and things that you probably never used ever before. And then all of a sudden you're being tested on it. And now years later, I still laugh at myself because I'm like, why would you say that? But yes, going back to what you were saying, no, you don't have to know. Those things will come. And as long as you put in the effort, right? Like I was putting in the effort and I was studying every night. And you're going to be out in the field during the day, and your day does not stop once you get home just because you're not on call yet. Your day, you get home and then you continue to study. Like I said, it's like getting a master's in EP. So if you're getting a master's, you might have your regular full-time job, but then when you get home, you still have to study. You're still getting quizzed, and they're testing you every so often. And this program, it wasn't oh, you're in the program and now, we just teach you. There were still tests that you had to pass and get certain percentages on, score percentages to be able to go on to the next level. And not everyone makes it out of the program because they're not able to pass.
Yeah, and just for our audience, give us like one sentence what that program was, just so they know, they have some context.
Absolutely. So it is about a 2 to 3 year program it's a 2 to 3 year program that gets you prepared to be a sales rep within the cardiac rhythm space. And so typically a lot of people will go to these pacemaker schools or such as ATI or PrepMD. But these bigger companies now are starting to have these associate programs, if you will, where they're training people on the job training and teaching them how to become a sales rep at the completion of it, or a clinical specialist at the completion of it. And so they're expecting you to work. I mean, you are getting paid for it, right? But they're expecting you to work, but they're also expecting you to pick these things up quickly and learn the material and be able to apply it, and then be able to be on your own and do the work independently.
Right. Yeah. A lot of these bigger companies are doing programs like that. And that's why when you were in our program, we focused on getting into a company offered program like that, as opposed to going to an outside school where you spend a lot and you still risk, maybe not even getting the position. So yeah, that's exciting. Okay. Now, your new opportunity, is it cardiac rhythm or is it something a little different? Why don't you go ahead and explain to the audience?
It is something a little different. So this new opportunity, which I'm extremely excited about, it is as a cardiology account manager. So not in cardiac rhythm, but still in that cardiology space. So less clinical, still very technical. And it's selling a diagnostic agent for echocardiograms. So extremely excited, a little bit different. So there's more negotiation that goes into this, more of the type of selling that I honestly want to be in. Cardiac rhythm. Another thing about that is that I think that people are mistaken with that type of selling when they say, I want to be a sales rep in cardiac rhythm. You are not selling, you're not going into an office and saying, hey, use my pacemaker. These physicians, in all honesty, they look at every company makes a pacemaker and every pacemaker does the same thing.
Me
What
too.
you're selling is the support. You're selling yourself, right? You're selling yourself and the clinical support. You're selling that they're going to make sure you're ensuring that patient safety is going to come first. You're going to do everything right for this patient because at the end of the day, like I said, if you don't have a lead, it's not like they say, I'm going to wait for you. They go to the next person, right? There's very subtle differences between all of these different companies. And so when it comes down to it's just physician preference, right? And so this type of selling with this new opportunity that I have is the selling that I want to do, right? Where I'm able to carve out a share of the market and I can actually go in there and it's more competitive and there's more negotiations happening, not necessarily, oh, well, I like this person, so I'm just going to continue to use this product.
It sounds like you've been on both sides of that.
Yeah.
Got it. Got it. Very cool. Well, this is so exciting, Crystal. And one thing I want to touch on real quick, people that aren't in the industry, they hear the big companies, they hear all these big names, and they think that the goal is to get into these companies because they can set up the career and everything go very well. And that can very much happen. But I think one thing that people should know is regardless which company you start with, the reality is, like you said, understand the space you want to get into first. Get into that space, perform, do the job to the best of your ability, and then the world kind of opens up. Is that what you'd say? Would you say that that's true?
Absolutely. Absolutely. You know, I got into the program and, wanting to be a sales rep for this company. And, I became a clinical specialist and I loved it. But throughout the program, my eyes were like wide open because I was like, there's so many other things out here, right? You don't know it until you're in it. I didn't come from this space. So I only knew what I knew. And I was like, I knew about that specific company because I happen to have a cousin that also worked for the company. So he
So,
was able to give me a little bit of insight, but I didn't know much about anything outside of cardiac
so,
rhythm and
so,
medical devices. And so once I got inside of it, I was like, oh, well, I mean, you can do this and have even, more of an opportunity or make more money or do this and have a better quality of life or it all boils down to what it is that you want. And I tell everybody that you have to know what you want,
mm,
right? And shortly into the program, I realized I was like, I don't know if this is what
mm,
I want to do, what I want to do, being a sales rep, you have to take more call than a clinical specialist typically. That was my reasoning for not becoming a sales rep. I'm kind of at the point in my life where I want to focus more so on family and I was like, this doesn't align with my personal life right now. In the future, it may be something I would love to come back to.
mm,
But right now, it doesn't align with, my professional goals, my personal goals are not aligning. So something has to change here.
mm,
And so once you get into it, you can kind of see, right? But I also tell people you have to put that time in. You cannot just get into it and say, after 6 months or a year and say, okay, I want to get up and go. No, you have to put that time in because people respect you more. Put the time in, but know what you want, know what your end goal is going to be. And I mean, you can get it. I'm a result of that, right? So now I got the opportunity in my dreams and the quality of life and my personal life and my professional life are now on the same page.
brilliant. I love it. I love it. Crystal, this was awesome, enlightening us with everything that you're doing in your career. We got to do this again, maybe in like a year or a year and a half. We
Let's
got to
do it.
revisit. Got to revisit Crystal. because as I said earlier, she was one of our early cohorts for the Medical Sales Career Builder program, and she's doing amazing things now. With that being said, then Crystal, can you share or can you participate in the lightning round?
Uh,
You like I set that up?
I know, I
Just
know. All
all the
right,
way
let's do it. Let's do
behind
it.
this
I'm
decision.
always up for a challenge. Let's do it.
All right, let's do it. So you have less than 10 seconds to answer 4 different questions, with the first one being, what is the best book you have read in the last 6 months?
Never Split the Difference by
Ooh,
Chris Voss.
I know. I think I have that one. Who's that by again?
Chris Voss? I believe that's his last name.
Oh,
Yes.
Chris Voss. Oh yeah, that's the
Yes. The
is he the expert
negotiation.
negotiating?
Yes. The
Negotiating?
ex-military.
Hey,
Yep.
that you know what? That guy's the real deal.
Yes.
What you know, I don't normally ask this, but I just got to know, what did you love most about that book?
Oh my God. So all the different negotiation techniques, you can use them not only, professionally, right, in your work life, but in your personal life. Not that I'm trying to get over on anyone, right? But it
She's
does
like,
work
yeah, I got
well
half the
for
city working for me right
family,
now.
right?
That's very cool. Never Split the Difference. Chris Voss. I like that one. That's a good one. Okay, best movie or TV show you've seen the last 6 months?
Oh, don't judge me. Okay. And I'm only going to say this because I'm watching it right now. Please don't judge me. Audience, don't judge me. Love is Blind. Season
Why
5.
would you be judged for
It's
that?
not the best, but like, I mean, I'm watching it right now, and it's not the best season. Honestly,
I'm gonna be honest. I think the whole concept of marrying someone that you've known for 5 minutes, it blows my mind. But the generation that's on Love Is Blind and the ones that are coming after, they're all about that life, and they're
they
clearly,
are. I
right?
know. It's I'll be honest. I feel like I watch it for like shock factor. It's like almost like a car accident that you can't turn away from.
Watch
Just gotta
Crystal be
keep
on
watching
season 2025. Watch her be
it.
on.
I know. Watch out.
Okay. Best meal you've had in the last 6 months.
Okay, so I recently, moved further down south. And I will say that I had some really good barbecue from Hutchins. Oh my gosh, it was so good. I'm not even like a barbecue
So
person, but
where exactly is this Hutchins?
Hutchins, it's in Texas. Um,
Is it a chain?
they might have two locations. It's not a chain, but I will tell you, you will like smell like smoky barbecue for 2 days straight after eating.
But it's worth it.
It's so worth it. It's so
Okay.
worth
Okay,
it.
that's happening. Hutchins
Amazing.
in Texas. Okay. Noted. And then last but not least, what's the best experience you've had in the last 6 months?
The best experience I've had would say moving to a new city and getting this new job opportunity for sure.
That's awesome. Crystal, it was fantastic learning about everything that's happening in your life right now. Thank you for being on the show, and we can't wait to see the amazing things you go on and do.
Thank you. Thank you. Thank you for having me, Samuel. This is amazing. We definitely have to do this again.
Absolutely.
Now, was that a story or what? I mean, again, I can't, I stressed this in the beginning of this episode. This is why we do it. To be able to see something like that full circle, to be a part of it, to see the wins, it's awesome. So, listen, you just heard an episode, an interview with a client who now helps clients. And I would like to believe that this type of episode makes it clear what we do within this program. When Crystal found us, I want to say she was a medical assistant, and she had no sales experience, and I mean, you heard her. She's killing it, and she's on her way. So listen, if you want to get into the medical sales space, if you want to be a professional within a med tech company, and then I want you to go to evolvesuccess.com. And I'm going to clarify this a little bit. Whether you are someone who wants to be a medical sales representative, or someone who wants to be a clinical specialist, or someone that's been trying to become an associate sales rep in the medtech space, or even if you want a position that's not directly sales, maybe you want a support position, or a quality control position. This is what I want to say right now. If you want to work within the business of healthcare, with a manufacturer of healthcare, whether it's manufacturing a medical device, a drug, a test, if you want to be any part of that with your career, then I want you to visit evolvesuccess.com. I want you to fill out the application, schedule a time, make sure you get to your call on time. We get so many phone calls. We can't entertain people being late or not showing up. So if you're serious, go to evolvesuccess.com, fill out the application, schedule some time with one of our account executives. Make sure you make your call on time because they will not wait for you. And then you'll be trying to get back on the schedule, and then we won't let you be on schedule for months because that's how we do when people don't show up. And book some time. Have a conversation. It's time to do something a little different. I think the biggest thing that I can say in years of seeing people work to get these positions, and of course years being in the industry myself, and just everything I've been given an opportunity to witness, support seems to be the underlying theme. Because what we're selling is confidence, right? When you know where you should be in the field, when you understand your transferable skills, when you can showcase that with a number of resources that you created, when you're verbally supported by people that have had interactions with you and are promoting you being in the position that's open. When all that's working for you, what happens is you develop this deep-seated confidence, and it makes the process of getting a medical sales position or even a medical, let me stop saying medical sales position. Let me say an opportunity within a medical technology company, med device or pharma or test. You're going to be able to show up in a way you're probably not showing up right now. That confidence should not be underestimated. When you are clear on why you should be somewhere and you know how to deliver that message and you're practiced at it, you're going to show up differently. I can't stress it enough. So again, if you want to be in this space, go to evolvesuccess.com, fill out an application, and let's have a conversation. As always, we do our best to bring you guests that are doing things a little bit differently in the medical sales space. So make sure you tune in next week for another episode of the Medical Sales Podcast.
I hope you enjoyed today's episode. And remember, I have a couple programs that show you exactly how to break into the medical sales industry, become a top-performing medical sales professional, and also how to masterfully navigate your career to executive level leadership. Check out these programs and learn more at evolveyoursuccess.com. Stay tuned for more awesome content with amazing interviews.